Hello.
Hi guys,
How are you guys?
we're fine.
It took us about 20 minutes to arrange which angle we will try to make a video of. That angle, I don't like what my hair, and then this angle here, Dennis doesn't like his hair, so we just turn it into in between, so nobody gets it's just in the middle. But anyway, there's a lot of viewers that were asking about health insurance, what kind of health insurance we have. The truth is, we don't have health insurance here in the
Yeah, we
Philippines.
don't have health insurance yet. You know, that's always big, uh, a big thing in the back of our minds about getting health insurance. I mean, so far we paid cash for things, and we haven't had anything major. $12 to get a tooth pulled, or $20 to go see a doctor for something. So, you know, um, really, we're just kind of gambling. I mean, I know there's insurance out there available, Pacific Cross and Pacific Health or something else like that. But from what I understand, I haven't really checked into it myself. But what I understand, the more you pay, the better coverage you get, as with anything.
Right.
So unless you can afford to pay a huge amount every month, that's really going to cover something serious. And I don't know how the scale goes, but you pay $50 a month, you get coverage up to something like $5,000 or whatever it is. Then the more money you pay every month, the higher
More-
coverage you get.
Yeah.
So, if you're going to plan on some major thing happening, you're going to have a large premium. So we started to check into Phil Health, and Marissa's went down there and talked to them,
Yeah.
and they told her that she couldn't sign up for Phil Health and add me. That as a foreigner, I had to go down there and open an account with Phil Health, and I could add her. So we got to still talk to them some
Yeah.
more. That don't really make sense, but
Yeah, it doesn't really make sense.
yeah, it's just like anywhere. It depends on how many people you ask. Usually, you get that many versions of what it is. So we're gonna have to go talk to somebody again and get that's can clarify it for us. But yeah, Phil Health is the best way to go here.
Yeah.
If you don't have a lot of money for a large insurance premium. I mean, it'll cover you when you go to a
Public hospital.
public hospital.
Most of it they will cover.
Most of it, and then unless you have a real healthy budget,
Yeah.
then you can get private insurance, international insurance, and then you can go to a private hospital, which has better facilities and everything. But I really don't want to, spend a
Half-
huge amount of money on the assumption that something major is going to happen. Eventually, it will, but so I think we're gonna try to go with Phil Health.
Yeah, I'm still gonna check in with PhilHealth. Even though I already went there once, and I'm gonna go back again for another, maybe they will give me a different answer this time.
No, I'm sure they will. If
Yeah,
it's somebody
and
else.
the thing about PhilHealth though, well, as what I've heard from the people that told me, they said that they will cover most of your expenses at the public hospital, but when you go on a private hospital, they won't cover it, not even half. And
No.
I was thinking to myself, what is the point of like paying for insurance, and then they will only cover it in public, and when one of us gets sick,
Well,
or
it helps.
especially if it is Dennis, he can't lay in the foam bed with no AC in there in the public hospital, and there's like 10 people in one room, and there's like one or two watchers on each patient.
Well,
And
if that's the case, I'd rather be home. I
Yeah.
mean, I got an air conditioner here at least.
yeah,
But I don't. Even if you have Phil Health, it does pay a portion. If you go to a private hospital, it pays a portion of it, and it does help. But it depends on the circumstances and what you're going into the hospital for. Personally, I don't. You know, after 3 heart attacks, I don't know how many more times they could save me. So the next one's probably going to be it for me, but who knows?
Oh my God, honey. I can't even imagine that happening. I just assume you're gonna be living forever.
Yeah,
I
well-
assume you're gonna live until I get old. That's what I expected you to do.
Well, it would be nice, you know. I mean, it would be nice. When I got that when I got that triple bypass, the doctor on my last checkup said, "Well, there's no reason you can't live for another 20 or 30 years."
Yeah,
So-
if it depends on your lifestyle, though. That's what they
Yeah,
said.
right.
Yeah.
Yeah, it depends on the lifestyle. So,
And
I
yeah,
got to improve my lifestyle. That's for sure. I gotta lose some weight and get a little more exercise than I get right now.
yeah. The good thing about here in the Philippines is like if you don't have insurance, you can still go to the hospital if you have, cash or like that, or else you just want to have a checkup because you have an infection or something. You can go into the doctor. You don't have to make an appointment. So the doctor will accept you without having an insurance. It's $6, to $8, and then maybe the prescription. It's not really much. Just like Dennis been to the doctor like a few times or more, and he can go in there,
Yeah,
no
well,
problem.
You can go see any doctor and pay him cash, and you can get it. Unlike the U.S., if you don't have insurance, if you're on, you got Medicare. First, you got to find a doctor that'll accept Medicare.
Right.
You know, so it's a lot easier seeing a health professional here, whether it's a doctor or a dentist.
Yeah.
You know, and the fee they charge is not much.
Yeah.
You know, compared to U.S. where it could be hundreds of dollars or more.
And in the US anyway, even if you have insurance, unless you really have a full coverage, and usually, even if you have insurance, there maybe you have a 30% like copay,
Right.
something, you still have to pay on something, and it's still very expensive.
Yeah, it is very expensive.
Like my aunt had a eye surgery, and she still pay a very big amount on the copay.
Yeah. So yeah, I mean there is insurance available here for foreigners. PhilHealth is one thing, and when we get down there and find more about it, found out more about it and get signed up, then we can have more information and give you more information on it.
Yeah.
But right now
Don't have any insurance.
we don't have any insurance. But whenever we want to go to the doctor or dentist, you just make an appointment and go in.
So, you know what, honey? We don't have insurance ourselves, but our car has insurance.
Yeah.
So our car is more important than our lives.
Well, no, you gotta have insurance on a vehicle here.
Yeah, I know.
Yeah, you have to.
Also, having insurance on ourselves should be, it's
Should be a
necessary.
priority. But
Yeah,
we've been
priority.
here almost 4 years, and our priority has been finishing the house because it was just a shell when we moved here.
Yeah.
And we're gonna
Barely
dig out some
livable.
pictures of what it looked like when we got here.
Yeah, one of these days.
Yeah, one of
too.
these days, and do a video on that. But that was our priority, and then get a car.
Yeah. Like what we said, that it's really, when you have to go to the doctor here, you can go anytime, walk in. When you want to have a checkup, walk in. You just have to be in line. You just pay cash, and the doctor will prescribe you whatever you need. As a matter of fact, though, in a couple of days, Dennis has to go to the doctor and have something to look at.
Something to look at. No, I got this little thing right here.
Yeah.
And I don't know if it's a cyst or what it is. So he's going to do a biopsy of it.
Yeah.
It just keeps growing, and you're going to check it out and find out what it is.
Yeah, it's like, isn't it the black thing that you growing in here?
Yeah, it's like a little cyst that keeps
This?
growing.
This?
Yeah.
Yeah.
So I'm
Yeah,
just gonna
so
go check
we'll
it out,
see
but
what-
No insurance, and just pay cash for it.
Yeah. We'll see what he's gonna do about it. I don't know if he's just gonna laser it or he's
No,
gonna.
he's not going to laser.
Oh, he's not?
it. No, he's going to cut it out and do a biopsy on it.
I wonder how long it's gonna take.
It shouldn't take very long.
Yeah. See, if we just like something like that. If you
Yeah.
are in the US, you have to make an appointment. But in here, if you go to a regular doctor, like at the hospital here, you can just go in right away, no appointment. But for the
Usually they'll
specialist,
refer you. You know,
yeah,
the emergency room doctors here, they're, you know, very limited on, you know, what they can do.
yeah, the equipments, they don't
Yeah.
have, the machine to check at that particular,
No, they don't have the money for the equipment and everything else they do, or to do tests. I mean, they can do, you know, blood work and stuff like that, but
yeah.
you know, their finances are very limited.
So, but if you go to a big cities, big hospitals, I'm sure they have all that equipments though, and you just need to pay a lot of money too.
Yeah, I mean, the little town we live in, there's not a lot of doctors and a couple of dentists, but so you almost have to go to tag them to which is 30 minutes away. But you know, we were lucky and we were able to find a good doctor in the next town.
Yeah, Mawab.
Mawab, and and then he's going to refer us to a dentist. So you know, you can get good health care here,
Yeah,
and you just got to pay for it, and it's not really expensive.
right.
But you know, you're just gambling in case something major happens. But you know, PhilHealth is becoming a priority for us to check into.
Yeah, I'm gonna go back there again very soon.
So hopefully, I don't know if we clarified anything. Maybe we confused things a little bit. I don't know. But that's our situation with
Yeah.
health insurance right now.
Yeah,
And
it's
like
what our situation about health insurance, because of so many of the viewers asking about insurances here.
Right.
And just like Dennis said, it's like a gamble. But at least here you can go to the doctor without an insurance. You just have
Yeah.
to pay cash, and that's why it's very important to really put some, as money aside for your in case of emergency.
Yeah. Yeah. If you're able to do that, that's great. I mean, if
Yeah.
you can get able to put money aside and have a budget when you come here, but everybody doesn't.
Right.
You know, and that's why a lot of people move here because
It's very
a lot
cheap.
cheaper to live here. You know, especially on a fixed income.
Right.
You know.
We just really want to share with you about what kind of insurance we have. There's no insurance, and we still have to figure out how to get one.
Well, I'm sure we can get PhilHealth. You know, because I don't think that's going to be, you know, exorbitant, the monthly premium, whatever it's going to be. We're going to find out, but I'm sure we can afford to get that.
Yeah.
That's better than nothing, you know.
Yeah, right. Yeah, even if we have to pay like $10 a month,
Well, I heard it was like 30 something.
$30 a month.
That's what somebody told me, but I don't know if that's true.
That's too expensive. Well, maybe because you're a foreigner. That's why I need to clarify it again when I go there. Because, why is that I can't open it myself and put you in it. But instead, they want you to open yours and put me in it.
Maybe this week we need to go down and get some real answers and check into that.
Yeah. Well, that's it for, that's all we can really say about this topic of the health insurance. And if we find out anything, we'll let you know about, who knows, maybe when I go there, maybe we can really get the insurance. And
clear up all the confusion we created here.
why did we confuse them?
I don't know. I hope not.
Yeah, even I got confused. So, well, I hope that you guys.
It's clear as mud now.
Yeah. Thank you so much for watching our confusing topic.
Thanks for watching.
Thank you. See you soon.